All right. So I thought, we would talk about constipation and healthy means of elimination and how we can manage through some of that. I thought we would talk about what your stool is saying about you and how to interpret healthy bowel movements. Are you familiar with the Bristol stool chart at all?
I think so. I think I had to do it, and then I started following that, Dr. Walls,
Okay.
and she does that MS with the Walls protocol or whatever. That
Okay.
really applied to me, but she has a description of it too, and it cracks me up. It's
Yeah.
snakes and all this.
Yeah, it's so funny. I know, it's so funny to talk to people about this, but, it's a big part of your health,
Yeah,
where so many of your immune system resides in your gut, and so just making sure we're having healthy bowel movements, it's such a simple way to make sure you're maintaining your health, and it tells a lot about what's going on systemically. So anyway, Bristol stool chart. So, yes, it's a healthy stool is really considered a soft formed bowel movement. So, snake like bowel movement and brownish in color. So, fecal matter is 75% water and 25% solid matter. So, it can contain anything from dead bacteria to different substances that your body hasn't been able to digest. And it really takes about 3 days for food to pass through the system, which would result in the bowel movement. So, depending on how your stool looks, if it is more formed or pellet like, kind of hard and pellet like, it tells you that your stool has been sitting in your colon for, too long. And then the opposite, if it's loose and runny, obviously it's passed through your colon way too quickly. So, type 1 and 2 are going to be the hard and lumpy, really painful at times to pass. And again, it's just stool that's been sitting in your large intestine. And those are the folks who have chronic constipation. Obviously, there's different food sensitivities that can contribute. Irritable bowel, you could have diarrhea alternating with constipation. So there's all sorts of things that can contribute. Type 3 and 4 then are really considered optimal. So those are the optimal forms of healthy stool. It's sausage-like, snake-like, easy to pass. It's not mushy, it's not pellety, it's just easy and soft and formed. And then you have 5 and 7 where you're getting on the bottom part of the scale, and that's the watery, mushy. And again, that's the least amount of time that that stool has sat in that digestive tract in that colon. So it can really give us a good look of what's going on at your overall health. Not only the consistency, but the color. We know red and black, can indicate some sort of a bleed. Gray, believe it or not, like a grayish hue can indicate sometimes a liver impairment. Yellow, greasy, foul smell. And also yellow can also be more indicative of a liver condition. The greasy, foul smelling could also be that your body is not absorbing and breaking down fats well. And so you'll see that a lot of times in things like celiac disease, anytime you have a disorder with the pancreas. So that can all, you know, lean more towards that. So what do we do? Well, obviously we want to eat, a well-balanced diet, high in fiber. If you have any food sensitivities, it's really important to identify those. So elimination diet, you've done that before, where we're going through and really kind of removing all of those inflammatory foods, things like gluten, dairy, sometimes eggs, nightshades, nuts and seeds, or nuts, peanuts. So all of those foods that tend to be a bit more inflammatory, we remove those and introduce them one by one and see if we have any sort of reaction to that. And it doesn't necessarily mean just GI. It could be, anything from headaches, irritability, acne, skin issues. But the goal is really nutrient dense foods high in fiber. Fiber can help prevent or relieve constipation. So things like apples, carrots, beans, if you can tolerate beans. Movement is also key, making sure we're staying active. Obviously, water intake, lots of water intake, at least half your body weight in ounces is ideal. Colonoscopy, regular screening, we recommend those anywhere between 45 and 50, sometimes earlier if you have a family history. So, other things that you can do for constipation, aside from kind of the high fiber, drinking more water, one thing is not laying on your stomach. So, if you're a stomach sleeper, try to switch it to side or back. They make those squatty potties if you've ever seen or heard of those. Those are pretty interesting. Stress management, believe it or not, working on that vagus nerve to really focus on toning that nerve and being more in that parasympathetic space where we're focused on rest and digest. So things like gargling, humming, singing, those can all help to tone that vagus nerve. Any type of abdominal massage where you're kind of going in the direction of the large intestine, so you're going to go up, across, and down. Gentle massage can also help. And then, of course, like I mentioned, just movement, making sure that you're staying active. So, those are different things that we can put into practice, right? And then, if you need additional support, then we can talk about maybe adding additional fiber outside of, what we're already getting in our diet. We can, in terms of like a supplement, we can also talk about hydrochloric acid, which is, the our stomach acidity. So sometimes we have low stomach acid, and because of that, we're not breaking down and absorbing all of our food and able to secrete those digestive enzymes. So sometimes you do need a little support in terms of adding some digestive enzymes and hydrochloric acid. I also, one of my favorites is just warm water with lemon in the morning. I don't do hot, so I'll boil some water, maybe add a couple ice cubes, let it cool a little bit, and then I'll do about half a lemon and sip on that. So that can also help. I don't do hot because I believe it's if the water's too hot, it can interfere with the action of the lemon. So make sure that it's
Okay.
warm.
Do you do that every day or just if you have a problem?
I like to do it every day and just make it part of your normal practice.
Okay.
Yep. Pre and probiotics are great. So whether it's a blend that you have or you get your prebiotics in just the food that you're eating. Douglas Labs makes a good one. I think it's called 40 billion plus and or maybe just 40 billion, but I believe it includes a prebiotic as well. So that's a nice option. Marshmallow root is something that you can find in different products to help really heal the lining of the digestive tract. It's really good, almost as an anti inflammatory for the gut and helps to pull water into the bowel. So that's also really good for constipation. Things like ginger, bitters, even MCT oil. If you add that to your coffee, that can also help. When someone is new to MCT oil, I just, recommend starting, like, a teaspoon, very slow and working your way up, and you don't need a ton. And then you could also, if you're still having trouble, incorporate things like magnesium citrate, helps to, again, pull water into the bowel. Powdered vitamin C is really good, although I would caution not to do it too close to bedtime because sometimes it can be stimulatory, so more towards the, first half of the day. Coconut water is really good. Prunes, of course. Unfiltered apple juice is another good one. So all sorts of different ways that we can help to really stimulate and have regular bowel movements. What we consider normal would be 1 to 3 bowel movements a day, soft and formed, non-painful. We really like to get you on a regular schedule. So, let's say you wake up every morning and you have a bowel movement. That's kind of our goal. And obviously, movement, hydration, all the typical things. Now, if you've done all that and you're still having, anybody out there who's still having problems, still having constipation, then we need to take a closer look. Maybe there's more stool testing that we would consider. And you're familiar with the hydrochloric acid, but we do a TANE challenge. So we can incorporate that sooner than later, but more testing would be the stool testing. Sometimes it's a motility issue. and it's not a food sensitivity, but it's just more of a motility issue. And so that would require, further intervention and a closer look.
Okay.
Sometimes things like small intestinal bacterial overgrowth or SIBO that can also cause constipation. And then constipation can also cause SIBO. So we look out for that. So lots of good ways though that we can work on that. We talk a lot about detox, and our body is working every day to help detoxify everything that we come up against. And so part of detoxification is making sure that those exit doors are open. So making sure that we're pooping, peeing, and sweating. And if those doors are closed and we're constipated, we're not drinking enough, and we're not sweating and we're not active, then we're gonna have a really hard time getting those toxins out because the doors are closed. So really maintaining a healthy bowel movement is key.
Okay. How do you know if you have small intestinal bacterial overgrowth?
That is a great question. So there are a couple different types of testing that we use. You can do a breath test. We can do stool testing, and based on the interpretation can have an idea, but it's really in the small intestine. And when we do stool testing, we're looking at the large intestine. But primarily it's with breath testing. So we'll also look at symptoms, gas, bloating. Something that we often ask patients is, do you have relief in symptoms if you've ever been on an antibiotic? And if they say yes, they have relief, even if it's something that, the antibiotics they're being treated for something different. If they notice that their symptoms improve, then that's also an indication it might be SIBO. It's basically the bacteria is not pathogenic per se. It's not these terrible organisms. They're just misplaced. They're lost. They're in the small intestine, not the large intestine. And that's why constipation can sometimes lead to that, because with constipation, things are stagnant. They're not moving. And so that motility, that peristalsis isn't there in your gut, and things just kind of stay. And so a lot of times we'll do a specific diet plan for them to see if symptoms improve to help relieve some of those symptoms. But ultimately, to determine that, it's breath testing.
Okay.
And as always, if you have any questions, just don't hesitate to shoot me a message. So,
Okay. I will. Thank you.
and you're welcome. Have a good week.
Thanks, you too.
All right. Bye.